nice to have everybody here. We're so excited. We're actually going to ask everybody to mute your phones because we're going to get ready to hear our Black Anthem, a performance by Nala B.
Lift every voice and sing till earth and heaven ring. Ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of our new day begun. Let us march on till victory is won.
Well, we're going to take this moment to introduce you guys to a few people that we're going to do a little round table fireside chat conversation with. We'd like to first of all welcome Dr. Nikia Owens, who's the Director of Income and Financial Stability for Community Impact at the United Way of Greater Philadelphia and Southern New Jersey. Are you here, Dr. Owens?
Yes, thank you.
Hello.
Good evening.
Welcome, welcome. You're looking lovely.
Thanks for having me. Gotta pull it together, you know.
Listen, I get it. We'd also like to welcome Mikhael Simmonds, the newsroom practice change manager at Solutions Journalism Network. Are you here?
Yes, I am. Hello.
Hello, hello. He was jamming with us earlier. We'd also like to welcome Reverend Michael Robinson, the Director of Community Outreach and Hiring for Temple University's Lenfest North Philadelphia Workforce Initiative. Are you here, Reverend Michael Robinson?
Hey, Jen. What's happening, everybody?
Hey, how are you? I'm so excited. And then, of course, we have our Reverend Dr. Alyn Waller, who's going to continue the conversation with us. And we're just going to have a great chat with everyone in this group. We have some incredible people here to speak to this topic of civic discourse. And I just have a few questions that came up in the planning of this event. And again, if you all have any questions, feel free to type them in for these fantastic panelists. Let's just get right into it. So as the states reopen, how do we balance the health of the economy and then the health of our people? Who'd like to speak to that?
Dr. Waller really laid the foundation for that conversation by saying we should allow wisdom to take precedent and honor what the scientists are saying in terms of their professional opinion and insights. It's sad that we don't have leadership, political leadership that we can trust at the executive branch level. And so we have to lean towards what science is telling us. And I agree with what Dr. Waller had said a moment ago about being very cautious. Right now, I think it's premature for anyone to go back. And I know that certain governors and certain executive branch leadership have said that it's okay to wade back into the water. But in my opinion, based on what I'm reading from the World Health Organization and the Center for Disease Control and other professional agencies like that, to make such a move would be very premature. We see that when people do gather, the headlines have shown from time and time again in very recent headlines where right after these mass gatherings, shortly thereafter, we see individuals from those gatherings infected. and many numbers of those individuals infected with the virus, and in some horrible cases, even dying. So, like Dr. Waller, me and many of the clergy colleagues here in Philadelphia are siding with science, and we're going to still keep the doors of the church building closed, but the church never has closed. And so we're going to continue ministering and serving the community in our respective capacities to uplift folk. And me, a part of the Temple community, we're helping job seekers by offering virtual job readiness support services and also hosting employers virtually so that we can bring unemployed individuals together with employers through the virtual means of Zoom, Facebook Live, and other virtual platforms so that job seekers can connect with employers that are hiring right now in the midst of the pandemic and employers that are hiring right now and the foreseeable future of when the economy does fully open up, that they'll have their talent pool already lined up to be ready to start work.
Thank you, Mike. And I actually want to bring one more voice into this conversation, and that's Christopher Flood, the drummer, Norris. He's the community contributors and engagement editor for WHYY, and he's the former CEO of TechBook Online, which is a boutique digital publishing company. Are you here, Chris?
I am here. Happy Friday. Good evening.
Hey, happy Friday and welcome. How are you? Can you hear me well?
I can hear you. Thank you so much for having me.
Okay, fantastic. Chris, I'm actually going to toss a question your way. You know, we are disproportionately affected by this pandemic. Can we prevent the same old narrative going forward? What's your take on that?
Yeah, I mean, that's a good question. I don't know if in 3 months or in a financial quarter that there's anything that can be dramatically done to change some of the circumstances, but there are some micro things that could be done. Particularly, let's talk about dieting, right? Obesity is one of the premorbidities that make you susceptible to coronavirus. We should be promoting not dieting, but a lifestyle change. No fried foods, no junk food that's unnecessary, cutting out the sodas, limiting our carb intake, making sure we're eating and ingesting vegetables and superfoods, right? Avocado, broccoli, ginger, turmeric, lemons, limes, eating lean meats like chickens. Those are the types of things we can do in the short term to increase our immune system and to lower our body fat. I mean, that's something that could be done immediately.
That's fantastic and really good advice that I think a lot of us are considering more strongly than we probably ever have before. Let's really put that in the forefront. Dr. Nikia Owens, let me ask you, are there separate stats on the African immigrant population with virus, or are the stats Black inclusive of the diaspora? What's your understanding on kind of the information we've been getting? You know, what do you think those numbers are really including?
Right. So I believe that those numbers are actually inclusive, and they haven't yet, kind of parsed things out to, distinguish or, there's not a clear distinction, I think, at this point. And I would just also yield the reason, part of the reason is because they're not, they don't have enough tests to be able to test in a way that actually causes or that allows for the distinction or so forth. So I think it's just kind of collective right now. And I think more testing and, a better, more strategic process on that. It's just as if, Reverend Dr. Alyn Waller mentioned, he went to 4 different professionals and got 4 kind of different answers, right? Those are the kinds of things that we're dealing with. And so we're not even at a point where we can make a distinction. I do know that, and I just wanted to mention in light of your first question as well, is that, I'm taking a little bit of a different turn is that, those communities also are, significantly impacted. And we really do need to be, mindful of some of those immigrant communities and being able to create access and opportunity for them as well. And so one of the things I wanted to also mention as we follow, kind of those science guidelines, we want to also, make sure that our communities and those communities are aware of the access that they have, the opportunities, the resources that are available for them, so that, they don't bottom out as we experience this, experience this challenge in this pandemic. Because, at, United Way, we're also, as Dr. Waller mentioned, is that we are part of, United Way is part of the Philly COVID-19 Fund. And I'd just like to give a shout out to my coworker, Carnisha Kwashi, who actually is co-leading that effort and has really made sure that those immigrant organizations and those communities are receiving the dollars, small and large. She's helped to really build that model in terms of executing from a diversity, equity, and inclusion lens. And so I just wanted to just, mention that as, as we move forward, that like the company that, the African-American owned company that, cleaned the Enon Tabernacle Church, and how, Pastor Waller refers them and so forth. So there are things that we can be doing, the PA 30-Day Fund with Jeff Bartos as well as Jeff Brown, that are giving $3,000, trying to help minority small businesses. Because as we experience this, we can't forget that, as we yield to some of these, yield to the science and things of that sort, people, still have to, maintain their lives and a roof over their head. We're making sure that that's possible. And so if we can make sure and put out as much information as, to connect those individuals with rental assistance, financial assistance, other resources that help them ride this tide while we're experiences, as Pastor Wallace said, it won't last forever, but we don't want people to bottom out. And because if their parents, if that happens to their parent, then the kids suffer, and we don't want that to happen.
Thank you so much.
Jennifer.
I'm sorry, who wants to jump in?
Jennifer, can I dovetail on that question?
Go ahead.
When we talk about the African diaspora, I just want to share a couple of stats. When we look at Brazil, these are cases of people with coronavirus, as well as the deaths in these respective countries. Brazil, 291,000 plus cases, 18,000 plus deaths. Dominican Republic, 13,000 plus cases, 448 deaths. The entire continent of Africa, 99,000 plus, 3,000 plus deaths. Cuba, 1,900 cases, 80 deaths. Haiti, 663 cases, 22 deaths. Jamaica, 529 cases, 9 deaths. And Bermuda, 125 cases, 9 deaths. And that's all from the World Health Organization. Now, in comparison, America, 1.5 million plus cases, 91,000 plus deaths.
Wow. That's the stats. The numbers speak for themselves, right, Mike? Yeah.
Can I add to that a little bit as well?
Yeah.
Hi everyone, this is Mikhael, Solution Journalism Network. A lot of my work is working not just with newsrooms in the Mid-Atlantic region, but working globally, right? I was in Brazil last year. I was in Kenya the year before. I work with West African journalists. And, narratives are funny, just to put all of your questions into one thing. The narrative that the world, or at least the Western world, has of Black people is that we're always victims and there's nothing we could do about it. A lot of the places that he mentioned on the list, or a subgroup of the list, are actually doing well. And not by luck. There are smart people who put things in place and responded because they have agency, because they know what they're doing, and because the relationships within those countries are just different. So the narrative you hear about Africa is we're waiting for it to blow up in Africa because it's going to be terrible. The narrative you don't hear as much is the fact that Uganda got ahead of this and put protocols in place. Not perfect, but they got ahead of it. Nigeria has epidemic protocols that they applied to the pandemic. Not that Nigeria is perfect, but they've done a lot of work already. And you could continue listing. Rwanda is on that list as well. So while we think about what narratives we perpetuate or we hear about the community, we're a community that always resists and we actually succeed a lot. And we need to talk about the data behind that as well. It is not just a fluke. It's not just, wow, you're lucky, or okay, you all are different. It's no, people coming together, our people coming together in these different places and successfully responding. And we have to tell those stories with the how, with the what they did, what changed, what got better, what reactions were they getting, and how did they overcome that. And that is not just a question about COVID-19 as a virus/disease. It is everything that's intersecting with that. You know, as we mentioned before, it's business, it's school, it's education, not just school, but formally and informally. And within our own communities, as in Philadelphia, in New York City, in Atlanta, as well as globally, all of those slices where COVID-19 intersects with, people are responding and having successes. So sometimes we just have to have a different conversation among ourselves instead of meeting and saying, oh, this sucks, this is bad. It's more like, hey, do you have the same issue? And if someone says, actually, no, chances are that person is doing something different that you could learn from and that you could take or bring from that community into your own. And that is not just within the African diaspora, but that's cross diasporas as well. So that's something I want to bring back when it comes to narrative and how narratives help define us, but also strengthen us moving forward. What are the best practices we could take?
That's really strong information and a fantastic point, because there are other countries that are doing well, that have managed this. And you're absolutely right that we need to speak to that for our groups as well, to notice what the good parts have been and to take some lessons, which I think is the thing we don't do enough of. Dr. Waller, how best can people of color place themselves to rebound after this pandemic? And, you know, you mentioned a little something about the fall wave possibly coming. What should we be doing to put ourselves in position?
Well, I think a couple of things. We have to be informed, and we have to go to right sources. This one of the challenges that we face in our country is that we couldn't trust our national leadership, and so we didn't get good information. So we've got to be informed. I do fundamentally believe as a pastor that this is also a spiritual challenge to our country because of the soul of our country. I think we need to get back to God. I think that for all of us, this has been a time of centering. And so I think it is important. I think pre-COVID-19, I know within the context of the church, my world experience, there's sort of a lackadaisicalness that had hit the church. I think all of us, if we'll be honest, attendance had been down all over the place. And I think that this is a crystal clarion call to remind us that God is really real, and we need to prioritize God. I think we are going to need to rebuild community, because we won't be able to get out of this as individuals. There is going to be the need of ujamaa, and we're going to need to think about how the church intersects with the business community, how the business community intersects with our education, and how we turn over the dollar in our community much more, because we won't have, and new creative approaches. I think that what we're going to find is that a lot of offices are realizing how much of their buildings they don't need, how productive their people were at home. And because of that, I think we're going to see the workplace is going to look very different, and churches are going to have to ask, how can we fit into that gap? Education is going to be different. And these large church buildings that we have may be able to be used to help with the overcrowding of schools and so forth, to make sure that we get children in safe places. So number one, I think we have to stay informed. Number two, I think we have to get back to God. Number three, I think we have to think from a communal perspective. We've got to think ujamaa, and then be prepared and not surprised by, we're never going to be what we used to be. We're going to something different, and live in the new reality. Sometimes you can mess up your today because you're wishing for yesterday.
That's good. That's good. That's powerful. And I think a lot of us need to swallow that pill. So thank you. Thank you, Dr. Waller. Dr. Owens, I have a question. Wearing a mask, it's actually an unusually touchy subject right now, right? Like we're seeing all kind of reports about people that wear the mask, that refuse to wear the mask. We don't know. What is your take on the protection or the lack of protection of the mask?
That's a great question. I actually talked to I will be very transparent and honest. I'm not a mask, fan. I will be honest about that. But I absolutely wear one. To Pastor Waller's point earlier, it's not just about me, but it's about, others that are around us and those that we have a responsibility for. So I think, from that, obviously from that context, whether you're a fan of it or whether you're not a fan of it, it's not, this is not just about ourselves. It's about, the collective whole. It's about, a sense of having that unity in the sense of, if you're not a fan of it, okay, that's fine. It's not going to last forever, but you also have to be conscious about the people around you and make sure that you take the necessary precautions, obviously, that help to yield the best results. And so, from a most transparent lens, absolutely. I think that, it's important for all of us to do our part as we, kind of move through this pandemic, because it's about the collective and about the whole and not about the parts.
That's fantastic. I definitely understand. I buy the little colorful one so I can feel like I'm doing something. I'm like, I can't breathe. But
right.
We do our part.
Yeah.
Mikhael, tell me, what resources do you know? This is a topic that people brought up early on, and we don't hear enough about those who are experiencing domestic abuse at home.
For everyone here, Jennifer sent us a bunch of questions before, and I went through each one and I looked at this question and I said, this is the question I actually don't know the answer for. And I will be very transparent. And there's a power in saying that I don't know, but that opens up curiosity. Yeah. And I started looking, and there's Solution Journalism has a database of stories, about 9,000 stories now, of responses to problems. And this is clearly a problem. And there's one story in the database about a response to that problem. And that story is actually from the Philly Inquirer. It's in Philly, about this topic. And I'm going to share it in the group chat in a minute or so. But what I wanted to say is that is a very big problem. The stats showed an increase in 911 calls immediately as isolations happened, and then a drop off on those calls occurred. And the drop off is assumed not that it's happening less, but because people are trapped, more or less, and they feel like there's nowhere to go and there's no repress from this, there are less calls. What I would ask the group, because I don't know and I am learning about this topic specifically in this lens, is to figure out what organizations were tackling this issue beforehand and ask them what they're doing now. Again, these organizations, NGOs, churches, when a new problem occurs, when a new problem occurs, they don't just sit down.
It's a valid point. That does anyone know of resources that were available?
Yeah.
The National Domestic Violence Hotline, they have an 800 number, 800-799-7233. But it's important to get the message out, whether it be through churches or community organizations or social media, that if anybody is suffering at the hand of domestic violence, to call 911. Now, if they're unable to speak because they're scared and threatened for their life, there's a hotline that they can log on to. It's called The Hotline, thehotline.org. Or they can text Love Is to 22522. That's Love Is, and text to the number 22522, so that if they're scared to talk because their life may be in jeopardy, if they are heard calling for help, they can simply text Love Is to that number, and they'll get a response from the authorities. And it's also important to know that they can also file for protection from abuse orders, a PFA, and they can get that if they have been abused. And we must also understand this just isn't a gender specific issue. Domestic abuse also happens to men. And I know people may laugh at that and scoff at that and think it's not a big deal, that men should just, brush that off. But domestic abuse is domestic abuse. Mm-hmm. Whether it's at the hand of a man abusing a woman, or at the hand of a woman abusing a man, or if it's same-sex domestic abuse. Domestic abuse is domestic abuse.
That's good. Thank you for that, Mike. And that information is powerful. I'm actually going to hope we can capture that in the chat in case anyone needs that information or wants to share it. That's critical. And someone actually just, our Ama actually just reminded us that some businesses on Instagram actually volunteered for abused people to call, anyone being abused at home, to call in and say something like, I want to order a pizza, some code language, so that they can call authorities for them. So I actually saw that. I saw a very similar thing. I saw an Instagram story where a woman was abused and called and speak to the number so that they could understand she was in trouble. So that's a topic. I'm glad, Mike, you offered some really critical information on that. And yeah, please share that in the chat as well.
Could I also offer too that United Way, we fund almost 200 nonprofit organizations, and one of them, Women Against Abuse, that we significantly fund as well. We'll be able to provide, residential accommodations, because I know that's very tough, especially given the kind of, challenges and things that we're in. We also pay pretty significantly for a 211 information line. So all you have to do is dial 211, kind of like 911, and they will be able to connect you with shelters that actually have availability, connect you with resources. We have a family empowerment program that, will rehouse you with a focus on you as well as the child. So there's a number of different resources, but I really encourage them to call 211 or connect with Women Against Abuse, and we'll be able to get you the kind of resources and connection that you need.
That is fantastic. I didn't even know about 211, and this is why these kind of forums are fantastic. It's information that we can get out to the community. We're really in a position where we can be change agents, even in the middle of this pandemic. We had a recent FunTimes event where someone spoke to that. They said, you can feel kind of trapped in your home. What can I do? Who can I be right now? How am I effective? But the reality is that even if you're not working, there are ways you can share information or be a change agent even right now. And I'm actually going to just get one more question in. I'm going to squeeze one more in just because you guys are fantastic and you're giving us so much information. How is Black media kind of challenged or stepping up to the challenge in this area? And anyone can jump on that one.
I write for the Scoop USA newspaper here in Philadelphia and was a former writer for the Philadelphia Tribune. And I think the media, especially Black media, has stepped up huge. The National Association of Black Journalists is one agency that has really encouraged the spread of information. What we're finding is that, yes, Black media has been important. Like in Philadelphia, we have there's only one Black-owned, two Black-owned radio stations. That's WHYY. And then there's Radio 1, which has a host of stations under Radio 1. Our Black media, they're really putting out great information, print, television, and radio. But what we're finding is, because of the pandemic, because a lot of news media across the board are cutting their staff because of the pandemic and the economic impact thereof, we're finding that in Black media, it's more essential for us to support it because of the financial impact, negative impact that it's having for all media outlets across the board. And as Pastor Waller mentioned, if white media, in example, catches a cold, we catch the flu as Black media. So it's important for us to support Black media. just like it's important for us to support our Black universities, because, and I know this is veering off on a different topic, but I'll say this real quick and let others chime in. Right now, billions of dollars are costing universities to now shift, pivot, and operate online to serve our students across the board. And when you look at HBCUs, which are typically underfunded, which produces our Black journalists and produces our Black engineers and Black doctors, et cetera, when they go underfunded, especially during these pandemic times, they experience the greatest amount of cutbacks. So right now is the best time for us to support emerging Black journalists by supporting our Black institutions, whether it's the United Negro College Fund or just directly supporting the Black university of choice. I'll stop right there.
I think that media nationally has been challenged, and it's certainly no exception for Black media here in the city. But you do have individual journalists and institutions that are adapting. Sherry Gregg over at KYW and CBS3 is a perfect example of someone who's been doing consistent live broadcasts with interesting guests, and even her stories have been really relevant. And so I want to give her a shout out and applaud her. The Tribune is they syndicate a lot of the content that we publish for WHYY, which is relevant to a Black audience. But I had a conversation yesterday with a gentleman who actually started a newspaper during the pandemic. I know, we think about whether print is still relevant, but there's a publication called the Uptown Standard that's serving Germantown, Mount Airy, and the Northeast, the Northwest, and they have been thriving and connecting with small businesses. I think the biggest challenge that any media, whether it be Black or otherwise, that they're facing during the pandemic is the hyper flow of both misinformation and regular information, and the changing facts and circumstances that we know of the coronavirus. It's a reason it's called the novel coronavirus, is because it's so new. We don't really have all the answers. A month ago, you were told if you're smoking cigarettes or smoking weed, you're at higher risk. Today, the New York Post reports that if you smoke weed, you're probably better off not getting the coronavirus. A month ago, they said you should reduce your milk and cheese intake because it creates mucus. Now they're saying one of the things they're finding in coronavirus patients is a vitamin D deficiency, and they should consume more milk and more dairy products. Everybody ran out to go get Clorox wipes and bleach because they were told that you can touch surfaces and get it. Now the CDC is saying don't worry about touching surfaces. So I think there's an information fatigue that's happening in the public from a consumer level, but I think from an institutional level, the challenge is the editors and the writers don't know what's true and what's true at that moment.
That is so good. Yeah, go ahead. Someone else want to speak on that?
No, I was just saying amen.
Go ahead.
Amen. Yeah, that's good. And that term, information fatigue, oh my goodness, that's a word all by itself. I know I'm exhausted personally, with what's accurate. I just saw the comment that Chris made about don't worry about the surfaces. It blew me away. We just bought this major Lysol haul. And I'm like, what? We just got So, it is confusing. And I'm so grateful, Chris, that you spoke to that, though, because there's a responsibility there. And that was also encouraging, and kind of a great segue for me, because FunTimes Magazine, of course, is trying to be a leader. We're taking that position that we also want to be one that's trying to keep on the cusp of what's factual, and what can we validate. Understanding that information may change next month, and so it's a real responsibility, and it's difficult for the Black journalists. But I'm really grateful personally for not just those who have, taken the charge to start something new, but those who have really done their research and tried to get to the community via all of your networks. So to that end, thank each of you for participating in this panel. You guys have been, as expected, a wealth of information and very gracious in sharing that with our community.